As of June 2024, the state of Kentucky changed the regulations regarding senior care. Based on our understanding, Pointe Senior Living is providing initial detailed information to help you. And to educate yourself, go to KentuckySeniorLiving.org, Assisted Living Requirements. So what level of care does your Kentucky Assisted Living offer? Pointe Senior Living offers a comprehensive level of assisted living care at all of its locations in the Bluegrass State. Ensure your loved one can age in place with these essential services offered at assisted livings with the basic health licensure level, like Morning Point. With the Kentucky regulation change, it can be confusing. That's because all providers are now considered assisted living. The key is in the details, and we can help. Does your assisted living community offer assisted living care social, or does it offer assisted living care basic health, a more comprehensive care level? BB Kennedy, an RN and Vice President of Clinical Services at Pointe Senior Living, will break it down for you and explain what your options mean, what the differences are, and why it's important for your loved one. Here are the 13 most frequently asked questions.
The consumer needs to make sure that the assisted living level that they choose for their family member or mother or father, they need to make sure that it is able to meet their needs and that it is providing the type of services that they want and that it allows them to age in place and receive those future services that they're going to need as they age. The very biggest difference is probably between the social model and the basic health model. Even though the basic health model sounds like it's basic, what it's actually allowing is basic health services to be provided. So they will have nurses on staff, they will have certified medication aides on staff that will assist with medication management and delivery. So their care is going to be done by licensed individuals, where in the social model, it will not be by licensed individuals. None of these regulations were a surprise for us. We have not had to implement many new things. We've had to tweak a few things just to meet very specific wording in the regulations, but we were already providing those services. We were already doing those things. We already met the staffing services. And what's going to be confusing is that now we're all called assisted living. So the consumer is going to have to do a little homework and dig and ask questions to make sure they're knowing what type of assisted living they're getting.
Here are the differences for food and nutrition.
That is so important because so many residents, especially as they age, they're on special diets. They might need a low sodium diet. They may need a pureed diet. They may need a diet with alterations in the liquid content. They might need honey thickened liquid. And all these are very important aspects of their care. Also, the dietitians and the nutritionists approve and certify the foods for their special diets, such as low sodium, or if they need a heart healthy diet, or if they need low concentrated sweets because maybe they're a diabetic. So we can guarantee that when the dietitian has reviewed those menus, that's what the resident is getting.
Make sure you understand what medical and therapy services can mean for your loved one. Here are the differences.
This is huge. This is one of the biggest services that you get in the higher level of assisted living. And I don't think many families realize how much time and effort and coordination goes into this. It is a lot of work behind the scenes on our nursing staff. They're kind of that central hub that coordinates with the physician and the physical therapist and the speech therapist and the dietitian and the home health group. And when residents go on hospice at some point, that's a whole lot of coordination of care too. We take that burden off of the family so they're not having to make 10 and 12 phone calls to get everybody on the same page. That's our job to do that for them.
There's a big difference when it comes to nurse assessments and medication assistance.
This is also very important. All of our people that are giving medication are either certified medication aides or Kentucky medication aides, or they are nurses. In the lower social model, they do not have to be certified or be nurses, but they're only allowed to assist. They cannot administer, but they can watch and observe. And as individuals age, they begin to have a lot of difficulty with eye medications, ear medications. They just struggle with that and they cannot administer that. So our staff is able to do that. Another part of the medication is simply the management of it, coordinating with pharmacy, getting refills available on time. We have a dedicated long-term care pharmacy. So these pharmacists are used to dealing with the geriatric population. They screen their medications to see if there's conflicting medications for side effects from one medication to the other. They communicate that to the physician, maybe make recommendations that this drug may have less side effects, but you may get the same benefit. So there's really a huge benefit to our medication management team.
And here are the differences when it comes to nursing and therapeutic tasks.
Some of those things are residents who maybe have ostomy care, colostomies, catheter care. Those things can be done in our communities by a licensed and trained nurse so that you know it's being done right. Even some specific wound care can be done. In the lower social model, they cannot even delegate, delegation means a nurse trains a lower level person to do it and then they perform those tasks. They're not even allowed to delegate. So family could possibly come in and do those things for the resident, but when you have a catheter or an ostomy, those are several times a day care items that really need to be done for optimal health of that resident, and we're there with our full-time staff to provide it.
Make sure you understand staff qualifications. Again, here are the differences.
All of our staff are either licensed nurses, registered nurses, or they are certified medications aid or Kentucky medications aides, which means they've gone through a Kentucky approved program. You'll often find in the lower social model, they use the terminology med tech. That's not the official terminology by the state of Kentucky that is approved, and a med tech is usually an individual that the community themselves has trained just to watch and assist, but again, they cannot administer. So if the resident begins to decline and struggles with that, the staff cannot administer that medication.
And finally, make sure you understand CPR and emergency training in your community.
In the state of Kentucky, there is not a regulation that requires that CPR be administered or even that staff be trained in CPR in assisted living communities. In Morning Pointe, however, all of our staff are certified in CPR and trained in first aid. So unless your loved one is a DNR, a do not resuscitate, we will administer CPR procedures in the event that they needed it. In other assisted livings, if their policies don't require it, they may not administer CPR without having a policy that directs them to do so. So you need to be sure of where you're sending your loved one and what type of care they're going to get, especially in the event of a cardiac emergency. There's many reasons individuals choose a particular assisted living community that they go to. But anyone that enters an assisted living needs some type of assistance, and because of the normal aging process, they're going to need more and more and more assistance as they walk through that aging process. In the social model or the lowest level of assisted living, they're limited on what assistance they can give. If you end up having to bring in home health or physical therapy, you as the family or as the individual are going to have to schedule that and plan for that and coordinate it. In Morning Pointe, we do that for you. We also are ready to help that assistant age in place and provide all of the services that they are going to need, all the way up until hospice, if that's what they ultimately are going to end up needing. Care management is so important in helping keep your family member out of the hospital as long as possible, keeping them functioning at the highest level possible for them. And with a lot of chronic diseases such as heart disease, COPD, Parkinson's disease, vascular disease, osteoporosis, arthritis, depression, we could go on and on. You know what they are. There are so many. But all of these diseases are progressive and they do lead to a decline. And because we have nurses on staff that can evaluate them quickly, can recognize changes quickly, we also have therapy groups that are in our buildings. We call them our partners, and we don't use all different types of random therapy groups. We pick some of the best, and they're our partners in our buildings every day. So they're in there seeing the residents day after day after day, and they can pick up on those very subtle changes as the residents begin to have difficulty or begin to decline, and we can address them. We have physicians and PAs and nurse practitioners that are in our communities serving our residents every day, so we are able to respond very quickly to the changes that they have to really help keep them in optimal health and address those declines immediately. I feel like our director of nursing, we have a director of nursing in each community. There's a licensed nurse. They're full-time employees, and honestly, they're available by phone almost 24 hours a day. But we have other nurses that work the rest of the day also. But this director of nursing to me is like the hub, the central point for all communication. They communicate with the pharmacy, with the physicians, with the families, with the therapist. They are that central person that's really your personal coordinator of care. And that makes such a difference. So things don't get lost and fallen by the wayside. They are that care coordinator, and that to me is what makes a huge difference. In Kentucky, in addition to the social model and then the basic health model, there's an addition onto that basic health model that is called the dementia care. And you're getting all the services that you get under basic health. In addition, you're getting some dementia care, specialty care. And the regulations have really increased the training requirements for all staff. And this is nothing new to Morning Pointe. We've been doing this for years. That's why our communities are called the Alzheimer's Centers of Excellence. And so we meet all of the state requirements for that. In these programs, we also address really the social and emotional needs of the residents, in addition to their physical, their medical needs. So those are very special programs that we offer, in addition to getting all of the other basic health services.
Pointe Senior Living, continuing to offer a comprehensive level of assisted living and dementia care in Kentucky. Find a location near you. Pointe Senior Living, the region's choice.